As you may know, the global campaign, the World AMR Awareness Week, begins tomorrow. And as part of that, CSE will be conducting an entire week of a lot of discussions and interaction. And we are kickstarting this campaign with a live chat. And we have with us today Amit Khurana. He heads the Sustainable Food Systems team. Amit, thank you so much for joining us. The first question to you would be, what is AMR and how it happens and why it is called a silent pandemic?
Thank you. Thank you very much, Sukanya, for having me. So the question is very important, but very basic, but yet very important and critical. This is AMR Awareness Week, and it's important for us to actually know what AMR means. So this question has a lot of relevance, as a lot of us actually do not really get to know. Now, uh, AMR basically means antimicrobial resistance, which means resistance in microbes, for example, bacteria, fungi, um, viruses, against the drugs which are used to treat them. So this basically means if I'm using a particular antibiotic to treat a particular bacterial infection, and the bacterial infection, the bacteria that has caused the infection, if it has become resistant to that particular antibiotic, I would not be able to treat myself. And this specifically with reference to bacteria, this is largely known as antibacterial resistance or antibiotic resistance, which is actually the main problem out of all kinds of resistance in different microbes. There are resistances in viruses, there are resistances in parasites, in fungi, which are also problematic. But the antibiotic resistance per se is a very, very big concern. Now, the other part to this is why it happens. Now, the central thing here is to know it's the overuse and misuse of antibiotics that causes this problem. Now, why so? If a bacteria is exposed to an antibiotic, it is bound to select for resistance, and that's where a lot of genetic mechanisms play into picture, which I will not go in detail right now. But the single most point here is whenever bacteria comes in contact with an antibiotic, the chances of bacteria becoming resistant to that antibiotic increases. Now, where all it does happen? It happens in the human health sector. When we get ill, antibiotics are given to us. But the bigger problem is, if I may say, the bigger problem is antibiotic misuse and overuse in the livestock, antibiotic misuse and overuse in fisheries, because it is known that the quantum of antibiotic use there is much more. It is also known that most of that use is actually not for treating infections. It is non-therapeutic use. For example, we know that antibiotics are used as growth promoters in chicken. We also know that antibiotics are used for other non-therapeutic reasons, such as, let's say, prevention. In the name of prevention, antibiotics are misused in dairy sector, in fisheries. So this is the kind of misuse that is also now one big issue. It was always there, but the attention to this is now increasing. The third root, of course, is the environment. Of course, when you take antibiotics, a lot of it goes into our waste, fecal waste, let's say. Same goes with the animals in the farm. If the antibiotics are given to them, those will pass on through the feces, enter into the environment, into the food chain. Because the antibiotics were given in their gut, the bacteria will also if it becomes resistant, those resistant bacteria will also pass on to the environment. And then, of course, there's this third element, which is called genes, the third determinant, which is called genes, which can confer resistance to other bacteria. Those are also passed on. So the third route is clearly the environmental route, which largely comes from farms, factories, for example, which are producing antibiotics, and household settings, because all of us take antibiotics. And of course, it goes to the sewage. Why silent? Very important question. This is very unlike COVID. And that is one of the reasons why people do not it actually does not get the response it deserves. It happens perpetually. It is happening in a chronic way, but we do not get to know. because it is not acute. It doesn't happen like a COVID pandemic. It happens on a sustained basis. It keeps on happening in our everyday lives, but we don't really get to know. So that it's silent. Now the impact it has caused to us. So the real estimates, the actual estimates, people do not know. But yes, some of the studies say. Uh, for example, a big study came and said in 2019, it said that the estimated number of deaths uh, globally, which could be associated with a resistance, antimicrobial resistance, were about 5 million in that 1 year. Uh, about 1.3 million deaths were directly attributed to bacterial resistance. There is also a very big review which says by 2050, if not much effective action is taken, about 50 million people in the world will die per year, and that's a big number. So that's where the concern is. Third part to this also is, other than the human health or human mortality and morbidity, the impact is on food security. The impact is on livelihood. The impact it is in fact it is said that it will impact the attainment of sustainable development goals. So clearly is a big, it is therefore known as one of the biggest global public health threats now.
So Amit, so this year the theme of the AMR Awareness Week is preventing antimicrobial resistance together. So what are the biggest challenges that need to be addressed to successfully handle this crisis?
Uh, well, one, of course, is that it is silent, it is complex, and there's a lack of awareness around that. But yes, uh, there are many challenges. The other, of course, is it's about one among the many challenges. I mean, in low and middle income countries of the global south, for example, you have challenges of education, you have challenge of nutrition. There is this big challenge of food versus safe food. So that's one another challenge. In the same context, we are more and more becoming intensive and industrial in the way we are producing our food, and that comes with a cost. We are becoming more and more dependent on the chemicals for our food production. It is also a trade issue. It is also a livelihood issue. Waste management, of course, in our part of the world is also a concern. So that poses a challenge. But if I have to say what is the biggest challenge, the biggest challenge I would say is political will. That stems from a lot of factors. Part of that is it being silent in nature. Part of the fact is you don't have much funds because there are competing priorities. But the political will is very critical. And another big challenge, of course, is the One Health response, the One Health nature of the problem. You have animal problem, animal sector problem. You have problems from the human health sector, problems coming from the environment. That makes it a very complicated approach.
Mm. So the final question to you is, what do we need to do, and what are the solutions? I mean, do solutions for rich and not so rich countries vary, or is it the same?
Yeah, so clearly one is about awareness. One is about making it a citizen movement, if I may say so. It's about political will. It's about funds. And yes, when it comes to funds, more of those will come from perhaps the richer countries.
Yes, yeah.
When it comes to One Health response, uh, it's needed everywhere. It's same as it's a solution which needs similar attention in rich part of the world as well as not so richer parts of the world. When it comes to the idea of prevention, it's very useful. It's something that is useful or much more beneficial for entire world, but much more for the low and middle income countries. When it comes to the way we are producing our food, we anyways have to move towards sustainable food production. We have to transform our food systems. We have to move away from the intensive farming, and there the LMICs, of course, have a much better advantage. We can leapfrog. We are not as bad as or as intensive as the way meat, for example, is produced in richer parts of the world. But in a nutshell, if I may say, for a country like India, or for a country which belongs to a global south, or it's not a very rich country, it's a low income country or a middle income country, the way we see this is that it should adopt three or four broad agendas. One, of course, is the development agenda. We all have to grow. These countries particularly have to grow in terms of food, trade, production. A lot of economics angle is there. But you have to grow without your grow, but you have to grow your food. You have to grow your food for trade, all that with less chemicals. You have to transform your food systems. So it's no longer about just put in more chemicals, put in more industrial food production systems, and then we will grow and that will help. So the development agenda has to change for our part of the world. The second important point is prevention. We keep on saying it's good for everyone, but it's best for us because we do not have those many resources. For us, it is prevention is better than cure, much more than it is for other parts of the world. We would not be able to first give so much chemicals and then invest so much money in cleaning up the waste. We would not be able to afford that. So prevention is very critical. That also means creating settings, not rearing animals in a setting which actually causes infections to occur. So you have to be the entire animal rearing process has to be in a way it perhaps has to move towards extensive food production systems or much more decentralized food production systems where the so-called social distancing, if something that we have learned so clearly now from COVID, that is maintained by default, by design. Now, the third is conservation agenda. This is very critical. On one hand, we are saying develop more antibiotics, put in more money. A lot of that discussion is happening across the globe to develop antibiotics because the pipeline is shrunk, pipeline is weak, pipeline is not really promising. But we have to conserve what we have. We have to conserve the access is a big issue, access to antibiotics. We still have a bigger problem for access in our part of the world than, let's say, the excess with EXCESS. So what I'm trying to say is that what we have, particularly those which are life-saving antibiotics, which are called critically important antimicrobials, which are the last resort antibiotics used in hospitals and ICUs, those have to be conserved. And by that, we mean those should not be allowed to be used. It's much better, stricter monitoring and surveillance and regulatory system framework has to be developed so that we can conserve the life-saving antibiotics. And last, of course, is coming from an environmental organization, and environment being one of the root of this spread is the environmental agenda. That basically means we need to manage our waste well. Waste from pharma factories, waste from farms, waste from community. All this waste has to be managed in a way so that it becomes AMR safe. It becomes so far we do not know much about the issue, the connection, the waste and the AMR connection. But as things are improving in terms of understanding, that part has to be very, very clearly understood and addressed upon. So these are the four broad things that we think we the response AMR response from for an LMIC should be looking.
All right. Thank you so much, Amit, for joining us today.
Yeah.
So CSE is marking the AMR week with a series of discussions and interactions. Do check out our website, cseindia.org, and sign up for our webinar next week. And there are also other events. Do check it out. Thank you so much for joining. Thank you, Amit, once again.
Thank you. Bye-bye.